Or
turn it.
Yeah.
Hello, Professor Jody. I'm Ann again. Here we are doing our final exam. This is my husband, Neil. And we're going to start right now. We'll start by saying, my name is Ann Dougherty, and we're going to continue our physical assessment. I would start by washing my hands. And the next system we would do, we would start with the heart. First, I would start by using both of my hands to feel in for thrills, which would be vibrations, and we would indicate an increased blood flow. Next, I would palpate PMI, point of maximum impulse of the heart, which is located in the mid-clavicular line, 5th intercostal space, right up to here. Then I would auscultate heart sounds with my stethoscope, and I would start with the aortic, which is located in 2nd intercostal space, 5th intercostal space, right side of the patient. Pulmonic would be next, which is also located in the 2nd intercostal space, left side of the patient. Then I would go to Earth's point, which is between 2nd and the 5th. Then I would go to the tricuspid with the 5th intercostal space, and then mitral, which is also the 5th intercostal space. And then last, I would use my bell, and I would try to listen for carotid bruits, which would be, for example, wishing sounds, and that would indicate less blood flow to the heart, which is not a good indication. Then I would go to the abdominal area, and I would inspect the skin for any cuts, bruises. Is the stomach distended? Is there any pain or anything? Then I would check his umbilicus to see, is it inwards, outwards, is it missing? Then I would check for hernias. Now ask the patient to lie down please. And I'll ask him to raise your head a little bit and take a deep breath, which would, if he had any masses or any nodules in this area, it would protrude and it would elicit pain. So you don't have any pain there?
No pain.
Okay, so next I would auscultate bounce sounds to see if they're active, hyperactive, minimum of 5 per minute. And I'll auscultate 30 seconds on each of the 4 quadrants. Right upper quadrant, right lower quadrant, left lower quadrant, and right left quadrant. In left upper quadrant. And then after that, after auscultating, I would listen to abdominal vessels. So I'll listen to the aortic, the splenic arteries. I'll listen to the renal arteries, 1, 2, and I'll listen to iliac arteries down here, down the groin area, 1 and 2. And then next I would percuss on all 4 quadrants. 1, 2, 3, 4. Looking for pain, looking for a sign that there's some fluid in there, anything that shouldn't be there. Then I would palpate with light palpation with 1 hand on each quadrant again. Then I would use both of my hands to palpate a little bit deeper. Deep palpation. See if it elicits any pain or anything. Okay. And then I would turn around, please. I would check for a CVA tenderness, and I would hit where the kidneys are. And if he has any pain or anything indicating any kidney disease, and turn around, please. I would check for rebound tenderness. If lie down, please. I would check for rebound tenderness, and if it elicits pain when the skin rebounds, and that means that he has a kidney inflammation. So, and then after that, I would check for a Murphy sign, which is located in the left upper quadrant, and that would indicate gallbladder disease. And also, I would check for Murphy sign, Barney sign, which is also checking for appendicitis, but that would be in the lower, in the right upper quadrant. That would indicate appendicitis disease right over here. And I also check for obturator sign and SOA sign. So stand up, please. I would ask him to raise his thigh. Can you raise his thigh? And I would push it down. If it elicits pain, that could be appendicitis. And also kind of move your feet a little bit to the right and kind of twist it a little bit. So we're trying to elicit pain on the right upper quadrant, which would be, again, appendicitis. So after the abdomen, we would do musculoskeletal, which would be looking for joint deformities, anything that should not be there, and also checking on both of the sides. If we're looking for deformities and if they're symmetrical, again, that's what we're looking for. And we would start by checking inspection, palpating, and also range of motion. We would do range of motion against gravity and range of motion against resistance. We'll also do rotating, rapid alternating movement, and also a hand grip. So we'll do those two right now. Can you, okay, good grip. And also put your hands like this and flip your hands back and forth really fast. There you go, that's very good. So also, so now we'll be assessing for range of motion against so let's start by inspection, palpation, and range of motion. So I would start with his TMJ, and I will look and see, is there a jaw hanging lower than the other? If everything looks symmetrical, we start with his neck. Is it protruding? Is it, higher than it needs to be? Is it in the right place? Inspect his shoulders. Are they symmetrical? Is one higher than the other? Inspect arms, fingers, hands, feet, and also I would do next, I would start palpating his jaw, his TMJ, any tenderness, any pain, his neck over here. I'll ask him to flex your neck, extend your neck. I'm looking to see if anything moves the way it's not supposed to move. Can you please turn around? I'm going to inspect his shoulders and go external rotation, internal rotation of the shoulders. Very good. Stand up, please. I will check his back. Any lordosis, any scoliosis. Can you touch your feet?
No.
Touch your feet. I'll check over here and see if there's a curvature, if it hurts, if his shoulder hangs around. Go back and sit down, please. I will do his fingers. Check his fingers, distals, proximals. Can you move your wrist, move your fingers? Again, very good. Stand up for me. Again, we'll be checking his feet and his toes. Lift your leg, this, put it to the side. Okay, the other one, we'll do the same. Make sure that you're both on each side, and flex and extend your toes and your legs. Okay, very good. So that's the musculoskeletal. Sit down, please. Thank you. Musculoskeletal system. And now we would go to musculoskeletal. Now we'll go to neurologic. Yes, next we go to neurologic system, and we would check. Okay, I would get the cotton swab and the cotton wisp, and I would check his face, arms, hands, legs, and feet, and I'll ask him to close his eyes, and he will tell me if he can feel this the same way as I'm doing on one side, if you would feel it on the other side. So close your eyes, please. Does this feel the same as this?
Yes.
Does the same as this? Yes.
Yes.
Now do the same with these arms. Would that feel the same as this?
Yes.
Same. And then with his hands, I would do the same thing.
Yes.
And also legs and feet. Right here.
Yes.
Okay, so that's one part of the neurological exam. Then I would go and I would feel his, his deep tendon reflexes, which I pretend this is my reflex hammer. And I would start with the biceps right here. And then the triceps back here and here. There you go, right over here, it's biceps. Then I would do brachioradialis, right over here. Then I would do his knee, right here. His Achilles, right over here. And his Babinski's reflex, which is right over here, and his toes would curl. Babinski reflex. And I also, for DVT and home sign. Okay, so you lie down, please, and lift your leg at 90 degrees. Just one leg at 90 degrees. If it elicits pain, that would mean that he has some kind of a lumbar disease. And also sit up, please. So we're done with neurologic. Now we'll do genitalia and rectum. And we would start by checking the skin, making sure that it's, rashes, lesions, cuts, anything that should not be there. Then I would check the genitalia. Again, make sure there are no cuts, rashes, lesions, any protrusions. Then I would check the perineal area, make sure there are no swelling, no redness, no nodules around. Then I would check the rectum for hemorrhoids, any redness, any swelling or anything. And I would do a DRE, which is called a digital rectum exam, checking for fistulas, again, hemorrhoids, anything that should not be there. And if I was examining a woman, I would do breast exams. And at the end of the exam, I would go and wash my hands. And that would be it. So now I think I'm just going to go back and make sure that I've covered everything to check for, let's see, did I check for DVT, deep vein thrombosis, to do the Holman sign? I think I asked him to raise, can you lie down please? To just flex your toes. Yeah, if he elicits pain, that's for, that would, we'll be checking for DVT. That would be in the vascular system. I think I covered that just to make sure. I check the arteries. I check the abdominal vessels. I check the pulses. I check the deep reflexes. I went through the heart, the abdominal system, went through musculoskeletal system, heart, abdomen, musculoskeletal, vascular, the genitalia, neurologic, and I think that's it. I think we're done, and I can't think of anything else that I didn't do. Let me just think again. Heart, abdomen, musculoskeletal. Okay, I think that's it. Thank you so much, Professor Jody, and it was a pleasure being instructed by you. I definitely learned a lot, and I hope to see you too soon at campus. Thank you very much.